Guyana is working to encourage the public to take the human papillomavirus (HPV) vaccine as the country begins its observation of Immunization Week 2024. The theme of this year's World Immunization Week is Humanly Possible, Immunization for All. Minister of Health Dr. Frank Anthony said Guyana has an outstanding record in the general immunization of children, recording 98 to 100% coverage. However, there is a challenge in the rollout of the HPV vaccine. A mere 40% of children between 9 to 15 years have received the vaccine.
We want to take this up to close to 90%, and therefore we still have a lot of work to do. So again, for parents, we want you to bring your children out to get vaccinated, especially if they're within this age group of 9 to 15. Why that is important? It's important because if you get the HPV vaccine, it can prevent cervical cancer. And for boys, because we're doing it for both boys and girls, for boys it can prevent other types of genital cancers.
The vaccine was initially available only to children ages 9 to 15 years. However, women up to 45 years are now eligible to receive the vaccine. Dr. Anthony explained that women between 16 to 25 are required to have 2 doses of the vaccine, while women 26 to 45 are required to take 3 doses.
We have seen in other countries where there's high vaccination rates that there have been a dramatic decline in cervical cancer. Right now, cervical cancer is the number 2 cancer among women in Guyana. So by getting this vaccine, you can prevent yourself from getting cervical cancer and possibly dying from cervical cancer. So we can change this with a vaccine that is widely available right now. And it's free of cost. The government is providing it.
The HPV vaccine was first introduced in Guyana in 2009 among girls between 9 to 11 years of age. Guyana is in good standing with regards to immunization coverage. World Immunization Week raises awareness and increases coverage of immunization against vaccine-preventable diseases and is observed annually during the last week of April.